Good morning. Good morning. Boy, I've had to follow Elijah several times in the past, so I kind of expected this. This reminds me of, thank you. This reminds me of a few years back when I was living in Michigan. I was speaking at a high school in Detroit. Speaking to high school kids, trying to inspire them. You are somebody, you can achieve, that kind of thing. And so just before I was to go up, there was this was back in the 1980s, so I'm dating myself. Just before I was about to go up, they pulled me to the side and say, well, wait, there was a big concert that night. The hip-hop artists were in town, and one of them wanted to come through and speak to the kids, and could you let him go first, and then you go. And it was LL Cool J, who at the time was really big, right? So he comes out, and he starts rapping, and he runs up and down the aisle, he rips his shirt off, and then as he comes backstage, he says, okay, well, good luck, you're next, right? So here I am following LL again. So I need to apologize that I have another engagement on the Eastern Shore because, the problems that we engage here in Baltimore are not just urban problems and not only problems of Baltimore. And I need to get down there, not going to the beach. I'm actually going to deal with some issues down in Somerset County. So I'm going to have to leave abruptly. So just forgive me for not being able to stay around and be a part of the dialogue, which I would really love to be able to do. But I did have a few remarks that I wanted to make. I wanted to talk to you about in three areas. I wanted to kind of frame a bit what's been happening within a historical context and make a few comments about that. Then I want to quickly segue into a brief discussion of the elephant in the room, and that elephant is racism. A word that hasn't been uttered yet, but I think it's important that we just call it what it is. Racism is a piece of the problem here, and it's a part of what we are encountering. And then finally, I want to make a few comments about the ultimate point, which is, what is our reaction? What is our response? What do we as a public health community do? And I want to say a few things about that. And I want to talk about each of these three things intersected with three cross-cutting themes, and they are structural, interpersonal, and individual. Structural, interpersonal, and individual. Because these are the various levels on which we can act and must act. So first, let's talk about the historical context. I know that when we talk about slavery, we often get a visceral response, which is understandable. Who wants to talk about slavery? Who wants to own the benefits that came from slavery? And who wants to own the legacy of the detriments that came from it? It's perfectly understandable. I certainly don't want to. Nobody does. But we must engage it because, slavery has been called the original sin of this country. And through our journey as a nation, the underlying current, the undercurrent of much of the narrative thread of our history stems from that original sin. And much of what's happened as an underlying narrative deals with the fundamental problem of what do we do with all of this surplus labor. So in the 1600s, Europeans discovered that there was another part of the planet and that there were natural resources and that those resources could be extracted and that you would need labor to extract those resources. And that you can go into the southern hemisphere, get people to come to the western hemisphere and help extract those resources. And that's basically what the slave trade was about, extracting natural resources. Now, this was a structural issue because this was about economic growth and development and the evolution of the West, which was quite successful at developing great wealth. Now, that's a structural issue. The interpersonal problem comes because if the narrative of slavery was simply, we need labor, we have the ability to forcibly take the labor, and we'll do that for a while, and once it's over, it's over. If that was the narrative, we may have had a different outcome, but instead, the narrative was, we enslave you because you are a sub or inferior version of humanity. You are inferior. And we believe, right, as enslavers, that they are, in fact, inferior. And those of us that are being enslaved come to believe, in fact, that they are, in fact, inferior. And this is where the interpersonal part comes in. You internalize that belief system so that when it comes to needing the empathy to enact policies that will improve people's lives, that empathy is lacking. When you need the personal efficacy, the personal agency to take change on your own, often that personal agency is lacking because of the internalization of this belief of inferiority. This is the elephant in the room, and if we're ever to make progress, we need to discuss the elephant, because the elephant is here. Over the years, we've had many opportunities from a policy standpoint to intervene, to address these issues. We went through slavery, we went through Jim Crow segregation, we enacted, as a nation, enacted a set of policies to ensure that the recently freed slaves would not be able to evolve culturally, politically, economically. Baltimore was the epicenter of redlining, and if you look at the maps of redlining, and you look at the maps that are now food deserts, and we look at the communities that are now flooded with alcohol and crime, they are the same places that were redlined. They are the same places that burnt last week, okay? So there's a historical thread that leads to the events that have occurred here in Baltimore. Baltimore, by the way, is emblematic of the nation. We are an example, and right now the camera's glare is on us, but what we experience here has happened or can happen everywhere else in this country. So racism operates on 3 levels. There's a structural level, and it operates on the structural level without the necessity of individuals holding any malice in their hearts against anyone. It's not necessary to think lesser of people if you enact policies that ultimately lead to negative consequences for people in certain communities. For example, sentencing laws that require that people be convicted as after 3 felony convictions, that you are basically in prison for life, right? So a policy like that has a differential impact on different communities and doesn't require an individual to be personally racist or have any personal feelings about any other group. Well, we have these policies, and these policies create differential opportunity structures. The interpersonal level is the individual interactions. So one of the stories that really hasn't been well reported in the news media is that a disproportionate number of the stores that were burnt and looted were stores owned by Koreans in West Baltimore. This hasn't received much media attention, but I think it's pretty well known among people who are involved in the city. And this is because of the interpersonal interactions, perceived or otherwise, between the store owners, the belief that these store owners are not part of the community and don't interact with their customers in a way that is loving and caring, okay? So these interpersonal interactions need to be dealt with. There needs to be a dialogue. There needs to be better understanding between the people who basically control the economy within West Baltimore and the people that live in West Baltimore. And that's an interpersonal interaction that needs to be improved. And then there's the internalization of racism. It is easy, or easier, for us to commit violence against each other if we also do not value each other. So if it is the case that the undervaluing of Black life is an American value, it is also the case that African Americans are Americans too, and therefore subject to the same values of the society at large. I point out, another elephant, that 3 of the 6 police officers that were charged are African American. So last summer, as we watched Ferguson, Missouri burn, the narrative that came out through the media was that you have a predominantly black city with very few blacks in leadership. And if only we could have more blacks in leadership in Ferguson, we wouldn't have these problems. A third elephant, as we look at our city, Baltimore, a city that has had black leadership for several decades now, and we see the same reaction. So it is not merely the matter of putting a black face in a space and expecting that change will occur, right? These are the uncomfortable truths that need to be spoken, I believe. I drove through Penn North. I've never heard it referred to as Penn and North before, right? It's Penn North is what we always call it. I drove through that area last Saturday, to see what was the aftermath. And I must tell you, it didn't look very different to me. Have you been there? Have you been there recently? It looked pretty much the way I remember it. You know, the CVS was burnt, and that was new. That was a new change. Other than that, I didn't notice a lot of change in Penn North. Right? All right? So let me move on to this last comment, which is, what is the role of Johns Hopkins? What is the role of public health? What is the role of the academy in addressing these issues? First of all, let me say unequivocally, there is a role for public health. These problems are public health problems. Without question, there's a role, and we need to be a part of the solution. But what is that role? That becomes a little more complicated. You know, since I've spoke this much truth, I'll say, you know, there are some colleagues and friends I have that I would not want going into West Baltimore. You know, the congressman kind of, you know, I think, addressed that issue. I don't know how productive that would be. But the point is, there's a role for everyone, and we need good people everywhere doing everything. We do need to continue to do research. So let me kind of disagree with my good friend, Congressman Cummings. We do need to continue to do research because we do need to continue to learn better ways to address these problems. And also, there's precious little that we actually know about how to fix problems like this. So we do need to continue to do that research. And we need people here doing that work and doing it in a rigorous and high-quality way. But we also need people who will translate that research. So the congressman said there are two tracks of policy, and I'd say that, in politics, and I would say that there are two tracks in the academy as well. And those two tracks are to create new knowledge, but also to implement that new knowledge, translate that new knowledge, and also touch people where they live. But when we go into these communities, I do want to say a couple of things about that. There is a difference between intelligence and education. We often confuse the two and assume that if a person isn't articulate, that they're not intelligent. What I heard in watching the news media, and what I heard last Saturday when I spent the day with a community organization there talking to some of the kids in the neighborhood, I heard brilliance. I heard a great deal of intelligence. Brilliant people who don't have an education. And this is different. Education is really about teaching people how to express themselves well. So we're educated so we know multiple words to express the same idea, right? And that's what it means to be an educated person, right? You can express the same idea in many different ways, right? So you can have stitches or you can have sutures, you know, right? And ultimately, they do the same thing, right? But you need to know both words if you're an educated person. But an intelligent person understands the concepts, and there's a great deal of brilliance. So when we go into these communities, we have to go in with humility, and we need to go in with the spirit of partnership, and we need to go in understanding that there is an important distinction to be made between intelligence and education, and that you cannot use one as a marker for the other. There are, maybe not here at Hopkins, but there are some educated people that are not that intelligent. And so I want to close by making one final comment, and that is that the solutions that we come up with as a university need to be solutions that are cross-sectoral. that while what happened here in Baltimore is a public health problem, it is not only a public health problem. So that we need to engage multiple forces to come together, not just university people, but also people in communities, people in government, people in the private sector as well, right? And that when we talk about these issues in public health, we often talk about it from the standpoint of the term, what we call health disparities or health inequalities. But I want to say that there are, in fact, 4 great disparities that affect each other and are affected by each other. And I don't believe that we will ever solve the health disparities problem if we don't begin to engage all 4 of these, because our problem is causing that other problem, and the other problem is causing our problem. And these 4 disparities are health disparities, which we know very well. There are wealth disparities. There are disparities in criminal justice, and by that I'm mainly talking about incarceration and police action. And there are disparities in education, educational attainment. We will never solve one disparity if we don't understand that these 4 disparities cause each other and are caused by each other. I'll give you one quick example, right? So we know how high the illiteracy rates are in prison populations. We also know that people wind up in prison because of untreated and undiagnosed mental health conditions. And then we also know people come out of prison often sicker than they were when they went into prison. And the best way that I could think of to ensure that a people will not develop wealth is for them to be in prison between the ages of 17 and 34, which is the age period where most of us develop the human capital necessary to create wealth. So none of that, I'm sure, is a surprise to anyone in this room. So as we go forward with the day, and as we think about what is the Johns Hopkins response, what is the public health response, what is the city's response, and how do we respond in concert with our partners, keep in mind that this response must go beyond a narrow public health perspective. And thank you very much. I'm going to have to run now.